popular sekarang. I dapat even our client pun tanya, Emma, I nak buat second surgery.
No.
And suddenly, and true enough actually,
Yeah.
in your IG suddenly you talk about second surgery.
Yeah.
Okay, so actually why suddenly they talk about second surgery? Diorang kata diorang pernah buat like 1 or 2 years ago, but then diorang kata, Emma, I nak buat second surgery back. So I think I better ask Dr. Mus about this thing.
Okay, so basically, first of all, when we think the first surgery was not right. Maknanya patient, let's say for example, super obese, and you buat operation sleeve, which may not be so easy to do in those, especially BMI tinggi 60, something like that. So maybe the cutting was not perfect. In a sense, ada tempat yang dia boleh besar balik. So that's why we always emphasize the right cutting. That's the most important. So now this is a mechanical issue because the type of surgery was not cut properly. Or sleeve, let's say for example, for a super obese, tak sesuai because the patient couldn't achieve the target, was not being oriented properly, and the patient berat badan naik balik. Okay. Sometimes, cara potong dia tak betul, perut dia macam tersumbat ke ataupun twist ke, whatsoever, so we have to convert to another type. Or macam tadi kita cakap, patient ada very bad reflux. Still doktor dia buat sleeve, reflux dia jadi lagi turun. So the reflexogenic. So all this type of revision surgeries, either in a matter of the first cutting was not correct, or the patient tak jaga perut akan besar balik. Tapi besar balik kita accept 10 to 15% only. Bila besar balik lebih pada tu, berat badan akan naik balik, especially kalau patient dia akan force themselves and dia akan minum benda macam manis whatsoever. Or the third is from the third, the wrong surgery. So we need to convert from this type to another type. That's why all this redo surgery or second surgery or revision, they must have an indication. Or sometimes the surgery was too aggressive to the patient. Dia turun sampai dah kurus sangat. So kita boleh convert back to normal. Boleh, kita boleh reverse balik. Okay. Or sometimes is the measurement during the surgery was also not correct. So that's why there are banyak benda yang kita to decide to redo. Tapi patient, tak apa, lepas 1 tahun tak turun ni ataupun naik balik, I akan buat balik. Suka hati, tak boleh. Tak boleh. So kalau kita nak decide untuk buat surgery balik, we have to do some assessment. First of all, we have to assess the patient. Kenapa dia naik? Okay, so we need to know why the patient berat badan dia naik. Lepas tu kita nak tahu the surgery, jenis surgery. Sesuai tak sesuai untuk patient. From the first selection, was it like right or not? These are the things yang kita akan boleh buat, boleh. Sleeve kita convert to bypass convert to sleeve. The bypass will bring it back to normal. From mini bypass to the normal bypass or YGB, semua boleh. But it depend on the indication juga lah. Case by case. Boleh buat, boleh. Suka hati, tak boleh suka hati. So kita
apa doctors punya ni lah, assessment dulu.
Sometimes there is something we call it the bridge procedure. Apa maknanya bridge procedure? You buat surgery into patient yang macam 250 kilo, 300. Those patient not a normal patient. So you, kalau nak buat bypass, bypass first of all, operation lama sikit. So abuse lama, which is lagi risiko on the patient. Second, literally the possibility of, because you potong perut, sambung whatsoever, so it will be more complex surgery compared to just potong sahaja. So that's why to simplify the thing, we call it bridge procedure. Apa namanya? You buat sleeve first, kasih the patient turun, let's say 60, 70 kilo, 80 kilo, lepas 1 tahun, 2 tahun, baru akan buat bypass. This is, memang you decide. This is betul-betul, we call it the bridge procedure. Macam tadi kita balloon, kita cakap bridge procedure, patient tak fit, we put the balloon, bring him down, then this also we call it the bridge procedure. So you actually, jambatan yang you buat tu, is basically you want to cross for a while, so to get to the safe side, baru you akan buat the big surgery, which is the bypass.
After 1 or 2 years. That one is kalau yang memang
ni plan, memang plan. This we call the bridge procedure.
Interesting.
So tak ada suka hati.
Jangan suka hati.
Jangan suka hati.
Tanya doktor dulu, buat appointment dengan doktor dulu.